I'm Dr. Kshitij Manerikar. I'm consultant oncosurgeon and advanced laparoscopic surgeon. So, as we know that any cancer which particularly occurs in one particular organ, we call it as a that particular organ's cancer. So, if the cancer is take, uh, taking place in the breast, then we call it breast cancer. We need to know the gravity of the breast cancer. So, it is one of the most common cancers seen in the worldwide in the female population, and it is second most common cancer causing cancer related to the death in the world. If we speak about India, approximately 1 in 3,000 population of pregnant female and approximately 1 in every 1,500 to 1,800 females in urban population, we see the one female will be having the breast cancer. And approximately 60% of the diagnosed breast cancer patients in India are already in a third stage or fourth stage, that is in the advanced stage. So, this is the gravity of the breast cancer basically. Breast cancer, as we know, the breast is composed of the multiple the ducts, what we call as the lactiferous ducts. So, if the cancer is originating from this part, it is called as the ductal carcinoma. In these ducts, there are some small particles, what we call as a lobule. So if the cancer is originating from these lobules, then we call it as a lobular carcinoma. Then there is a mixed type of carcinoma and rare forms of some carcinoma. There it is inflammatory breast carcinoma and a mucinous breast carcinoma. But in general, the most common cancer, what we see in India and worldwide population is ductal carcinoma. So the invasive ductal carcinoma is the most common type of the breast cancer, basically. So there are multiple risk factors for the breast cancer. Let's start from the genetic factors. It is one of the most common and one of the very important risk factors. So familial history is very important in the breast cancer, but there is a misconception in the common people population that only if some patient's mother or some grandmother had cancer, then she will also develop cancer. Family history does not mean that only one family member had any breast cancer or any other ovarian cancer. So, multiple first related family members, these patients have higher risk of developing breast cancer. Then definitely now we all know the BRCA, that is BRCA1 and BRCA2. These are the genetic mutations. So these are the germ lines in our everyone's body. So if some mutations are there, these patients are also at a higher risk of developing breast cancer. But these things are not in our hand. The things which in our hand are with respect to early menarche, starting of the menstrual cycles in early ages, and menopause at very later age. So more number of menstrual history, menstrual cycles in the whole lifetime, it increases the history or it increases the risk of the breast cancer. The same way, giving the birth to the first child after 30, not doing the lactation or using hormonal replacement treatments, mainly which include estrogen and progesterone hormonal replacement therapy after postmenopause, too much of using oral contraceptive pills. These all are associated with the first degree risk factors in the breast cancer. And we need to understand why these factors, why we tell, or in an older population, they used to tell that you need to do the breastfeeding, you need to give you do a childbirth as early as 25, 26 or 27 year. Do not try for conception after 30, 35, 40. Why? Because these factors directly increases the hormonal changes in a human body, and because of the estrogen, which is the most important hormone in a female, because of the excess of the estrogen risk, all these increases the risk of breast cancer. Again, after that, obesity. The more the obese patient, then there are more dense are the breast, and in such females, there is the risk increases. So obesity, and then the factors which causes the obesity: alcohol intake, smoking, too much of fatty food. All these are associated with the breast cancer. So these are some of the most common breast cancer risk factors. Previously, age was also the breast cancer risk factor. As age increases, the risk is more. But now this dictum had changed. We see breast cancer as young as in 20 years, 25 years also. So it is not just the cancer of the older females or the cancer in the what we see in after 40s. It can seen in earlier age also. Some most common symptoms is the lump in the breast, what we call swelling in the breast. So it can be seen in any area. It can be just beneath the nipple, or it can be seen sometimes in the axilla, that what is called inside of the side arms, armpit. So lump can be there, which gradually increase in the size. Usually this lump is very hard and it is solitary in the, that is only single lump is there. Sometimes it is painful depending on the size and depending on the location. Then nipple discharge. So any type of nipple discharge other than the usual what we call white or milky discharge, that is not that associated with, but any bloody discharge, any greenish color discharge from the nipple, any recent change in the size and shape and contour of the breast, any recent history of nipple crack or pain while doing the lactation, or any scratch on the nipples, these can also be the common symptoms. So these are the early signs. Many of the times, people have a misconception that uh, the more the size of the lump, it will be the more advanced stage, and the lesser the size, so that the cancer is in early stage. So this is a actually myth. I want to debunk this myth that it is not like that. Even a small cancer of as smaller as even 1 centimeter also can be seen directly presenting as a metastatic cancer. Metastatic means the cancer which has spread. So breast cancer can spread to the lungs, it can spread to the brain, it can spread to the liver, and it can spread to the backbones also. So some of the advanced cancer stages symptoms are depending on the spread in which organ these cancers are spread. So let's say if the spread is in the lungs, then there will be the cough, difficulty in the breathing, shortness of breath after walking. If it is in the spreaded into the brain, then we can see the seizures. If it is in liver, then we can see the pain. So these advanced stages cancer symptoms are different. The early stage cancer symptoms are usually lump, painful lump or painless lump, and discharge from the nipple, and recent change in the size and shape of the breast. When the patient has symptoms, patient has to come as early as possible to the clinician and expert cancer surgeon. When they come to us, we do the proper clinical examination, and those people in which we suspect that it is a cancer, we do the diagnostic test. So first and the most diagnosis what we do is, depending on the age, we advocate for the mammography or sonography, so which usually tells about the size of the lump, location, and is whether it is more towards the cancer or more towards the benign in the nature. Once it is done, then we do the biopsy. So biopsy is simply that taking the tissue from the cancer. Unless and until we have biopsy, we cannot tell whether it is a confirmatory cancer or not. Not even mammography, not even sonography, nothing in this world can tell you that this is a cancer unless and until we take the biopsy. Once the biopsy is taken, then the next stage is, if biopsy comes positive, we know that it is a cancer. So then our next step is that we need to check whether this cancer is localized to the breast or it has spread to any other organ. So then we do PET scan, which is a specific scan and which tells us about the any cancer which has spread to anywhere in the body. And sometimes in some particular situation, even we can we advise for the MRI of the breast also. So basically, these are the investigation tools what we usually ask the patients to do. Basically, mammography is one of the investigation for diagnosing breast cancer or screening breast cancer. So there are two types of the mammography. Investigation remains the same, but depending on the purpose of our utilization, so it can be the screening mammography. So what is screening mammography is, we usually advocate after 35 years of age, every female needs to do mammography at least once in a 2 year, after 40 at least once in a ear to see whether any lump is there or any abnormality is there, so that we can detect the breast cancer earlier rather than detecting in a later stage or when the symptoms are appear. It is always better. So this is random rule that we should do it mammography after 35 or after 40 years. This is a screening mammography. It is an X-ray of the breast. So there are two views what we do. One is medial lateral oblique view and one is front view. So in these X-rays, there are some specific terms and specific characteristic what we see. Usually, it everything depends on the calcification. So this calcification has some specific landmarks from which we can diagnose whether it is a breast cancer or whether it is a non-cancerous normal benign lump in the breast. So mammography is one of the modality for investigating the breast cancer. Mammography should be done in a screening mammography at least once in a year after 40. But in an Indian real scenario, this does not happen. If I tell some patient that you need to do the mammography after 40 every, it is not possible. So I usually tell that at least once in a 2 to 3 year after 40 years. Those patients where the family history is stronger, that grandmother, mother, or some two or more than two family members had any history of cancer, maybe breast cancer or ovarian cancer. In such patient, we start screening as early as 30 years of age also. So in this patient, we recommend to do the mammography yearly. I also want to emphasize that mammography in a younger female is a painful. So it is not just the X-ray that, like we do the chest X-ray, that you are supposed to stand and X-ray will be done. It is not like that. So the breast tissues is placed in between the two slides, like what we call, and then the X-ray has been is taken. So it is a bit painful in those female who has large bulky breast or who are obese patients or in those who are younger one. So in such younger patients, sometimes we recommend to do the ultrasonography of the breast rather than going for the mammography. So it is also useful and it also identifies the lump. First, before telling anything about the treatment option, I want to tell that breast cancer with the recent all the modalities options what we have and the recent advances is completely treatable and curable. It is one of the best cancer which can be treated and patient can be cancer free absolutely. So every one watching this, they need to understand that this cancer is completely curable. So if and when it is diagnosed, treatment should start as early as possible. So there are basically four parts of the treatment. So there's a surgery, there is a chemotherapy, there is a radiation, and there is a hormonal treatment. So these four treatment, and once all these four treatment is taken, then there is a completion of the treatment. So depending on the stage, if it is an earlier stage and we can take out the cancer, surgery remains the treatment of choice. So again, in a surgery, there are two types of treatment. The traditional treatment where we completely remove the breast, and with the breast we remove the axilla, that is armpits, nodes, which is called as modified radical mastectomy. And then there is a newer modality of the treatment where we don't remove complete breast. We conserve the breast. We only remove the lump, and with that lump, we remove the axillary nodes. So this is called as a breast conservative surgery. And now we can do the minimally invasive breast cancer surgery using the laparoscope and robotic breast cancer also. So this is the newest technology with respect to surgery. After surgery, depending on the stage of the cancer, if the patient requires, then we give them chemotherapy and radiation, both, and then we give them hormonal replacement treatment. So hormonal treatment depends if the female's age and female's menopausal status. So if the patient has already acquired menopause, then there are different types of hormonal tablets, and if it is not, then there are different. Sometimes when the cancer is large, we don't go directly for the surgery. In such patient, we give a neoadjuvant chemotherapy. That is, we give a chemotherapy right away after diagnosing so that these cancerous growth shrinks in the size and almost sometimes they vanishes. So now, if the cancer is very small, even with the help of the chemotherapy, completely we can cure the cancer without surgery also. So with the latest modality. And this is one type of cancer where where the world has gone so far ahead that even in those patients where the cancer has spread already to multiple organs, let's say it has spread to the other breast, liver, lung, in such patients also, because of the targeted chemotherapy and targeted treatments which specifically target some molecules which has been diagnosed in those particular breast cancer, patient can be cured, or patient's life at least can be increased for 5 years and 10 years. So gone those days when we used to say it's a fourth stage or advanced disease and nothing can be done, and the life expectancy not more than 6 months or 1 year. Now even these patients can survive for 5 years and 10 years. Prevention starts with the risk factor, decreasing all the risk factors. There are some risk factors which are not in our hand, as I already told. We cannot change our genetic germ line. We cannot change our familiar history. But definitely, if your high risk family of ovarian cancer or breast cancer, more than two or more than three family members, such patients had to be cautious, and they need to undergo a strict screening right from the 30 or even sometimes before that. So screening, which can pick up the cancer earlier, is recommended in this patient, and then definitely decreasing the risk factors. So again, giving the childbirth in correct age, not overusing the oral contraceptive pills, not overusing the hormonal treatment, decreasing the obesity, so remaining fit, not having too much of junk food, and definitely decreasing the risk of alcohol intake and smoking, which these factors are at least in our hand. So if we decrease these factors, there are chances that breast cancer will remain away from you. So these things we can take care.